Hello, everyone. Thank you for joining us on this episode of BAEP Talks With. This is a 30-minute discussion or about with a person of interest who lives with, manages, treats, and or supports others with a chronic menstrual health disorder. My name is Julia Mandeville, and I am your host today. And today, I'm really excited because I'm joined by Dr. Simone McConnie, a podiatrist. And today we're talking about feet and the importance of good foot care. And what on earth do feet have to do with P.C.O.S. and endometriosis? Where does that come in all of this? So before we get into that, I'm going to tell you a little bit about Dr. McConnie. So she is a Managing and Advanced Podiatrist with 26 years working with wound and diabetic foot programs. She received her Bachelor of Science in Podiatric Medicine from the University of Westminster, London, England. From 1997 to 2000, she was a clinician and the head of the Department of Podiatry at the Queen Elizabeth Hospital. And between 2003 and 2017, she was the Chief Operations Officer and Chief Podiatrist for wound care and the diabetic foot at the Barbados Diabetes Foundation and the Maria Holder Diabetes Center for the Caribbean. From 2005 to present, she has rebranded her practice to Comfeet Footcare Clinic and provides all clinical management and professional leadership within Comfeet. In 2019, she was recognized for her exceptional work with the establishment of the Diabetes Center and Diabetic Foot Clinic and received the Oscar Jordan Award. Her passion is to reduce amputations and assist with improving lives for those living with diabetes. She believes everyone has the right to have 2 feet and 10 toes. Welcome, Dr. McConnie. Thank you so much for joining us today.
And thank you so much, Julia, for reaching out to me. It's come at a wonderful time where we probably need to be uplifted, and there's no better time than to think about our feet. I always say podiatrists are one of those people that, we're humbled by looking after people's feet, but also we love feet. They keep us moving.
Well, they do. Can't dispute that.
Exactly.
So why podiatry? So even before we're podiatry, what is podiatry? Let's start there.
Let's begin at the beginning, yeah.
Yes.
So podiatrist is a medical field related to prevention, management, and treating foot disorders. Mm-hmm. So all related things to the lower limb. And, we see pediatrics, we see matured feet, we see sports. And in Barbados and the Caribbean, you'll find that most of us have to do some of everything. But as you go into, like in the US, in Canada, in the UK, you will have specializations within podiatry. So diabetic foot and venous ulcers, those are all part of what we do. Some podiatrists only see pediatrics, some podiatrists only see diabetics, some podiatrists only see sports. And in that sports arena, it's actually called musculoskeletal podiatry. So it's quite a wide scope. And then we have surgical podiatrists as well. So as a surgical podiatrist, it will be fixing feet. So, some people with clawed toe deformities, straightening their toes or injuries to their feet, and they're usually foot and ankle surgeons. So they will do things in the ankle area and in the foot area. And that's come a long way as well over the years with reconstruction and, joint replacements, even big toe joint replacements and everything. So we actually have a huge scope. And I think that's what confuses people because they're like, okay, don't you all cut toenails? Yeah, we do that. We do ulcers as well? Yeah, we do that. Mm-hmm. Do you see a verruca? Yeah, we do that too. So we do quite a few things, and that's where confusion sometimes comes.
Yeah, as you were speaking, I was remembering when we did this with Jasmine and she went through the whole gamut of physiotherapy and all of those different, the different subspecialties within that field, which I had no idea about. So I love learning about these things because it's always great to learn new things, right? So tell us a little about why you specifically went into this field. What drew you to podiatry of all the fields?
To be honest, at the time of qualifying, as in when I say qualifying, leaving school, doing my CSCs, I knew I wanted to be in the health field because that's my calling is helping people. And I knew I wanted to be in the health field, but I just had a huge block to being just a medical doctor. No, nothing against medical doctors here. And when I say just a medical doctor, I don't mean that in any derogatory way. I just meant I needed something a little bit more creative, something a little bit more. And I actually did a lot of research. I looked at all various types of scopes of practice and specializations, and podiatry appealed to me. And then when I thought, okay, am I sure? Because there are no podiatrists in Barbados. I can't visit anyone. I can't talk to anybody about this. This is going to be all new territory. And then my uncle was a doctor, and I actually spoke to him about it. I worked with him a little while just to get it through my brain that I didn't really want to be a doctor. And then I was like, yep, I definitely don't want to do, I don't do bodily fluid. So then I researched it, and around the same time, Bradford Tate was our
Minister of Health.
Minister, and he had a huge call for podiatrists. And I thought, okay, well, that was a sign that, you know, maybe that is what I will do. And I was young enough that if I did it and I didn't like it, I could always change professions. And here I am 27 years later, still doing it, still doing it, still also swimming though, because podiatry, I have to say, has been a huge, it's like climbing Mount Everest as a profession, because it's new. It's still a new profession, not only in the Caribbean, but in the world itself. We are a very limited group of people as well. And as you move around the world, you will find that podiatrists are needed badly, but it's not, I guess some people just don't love feet. You know, they don't love their own feet. They just can't stand being around feet. And as a result, I don't think it's always an attractive field to be in. But it is such a rewarding field. Oh my goodness, it's so rewarding. So, I'm sorry for those who think it's not, and I'm sorry for those who don't accept us for who we are and what we can do. But there's a whole lot we can do, working with various types of teams and working. So it's just been a rewarding time for me over these 27 years.
So let's get into it then. So what are some common podiatric conditions?
So podiatry is such a, oh gosh, it's, as I said before, there's such a wide range of things we do. You know, many years ago, you would say that every 30 seconds, someone with a diabetic foot would lose a limb. Now we say every
it's a shorter time,
20 seconds, someone loses a limb to the foot. So
and is that globally, or that's just in a specific region?
That is globally, right?
So we're starting here.
Yeah, so I mean, remember we talked about the multidisciplinary team, and this lady, you know, she went through quite a few challenges. She was offered amputations 3 times, and each time she thought, no, I can't live without my foot, and she said no. And you know, she saw a nutritionist. We worked very closely with a podiatric surgeon in New York. And he reconstructed her foot. And the foot on the far left was a foot that they wanted to amputate here, and then the foot in the middle is what she has up to today, as in up to yesterday. These pictures were taken that fresh. And I'm showing you this because for her, this was not just, and what people don't realize, this is where the multidisciplinary team comes in. For her, it was not just cut off her foot. It was her entire life. It was what was coming next. And many surgeons said, well, whatever is done, she will eventually lose her foot anyway. Guess what? We are 3 years down the road. This is the foot 3 years down the road with no further interventions. So a lot of people feel that diabetic foot with amputations or with challenges, it's just to get through the challenge. But no, and this is where the joy of our job comes, because for me to see her yesterday and just go, wow, you know, that I was part of trying to coordinate her care. You know, she has special shoes that she wears, special insoles that she's wearing. The one on the very end is like a little bootie that she actually puts the foot in, and it harnesses the foot from moving around in the shoe. So she doesn't get any frictional forces, because mechanically you will see when she stands up, that same foot is tilting on the outside.
Right. Yeah.
So if we didn't do anything to manage her mechanical forces and didn't do anything to manage her calluses, which she does get calluses, and that's why she keeps coming. And even the scar at the bottom is really where the surgical procedure was.
Right.
She would end up with huge calluses. She will have another ulcer, and that's how you will lose your foot again. So this is the role. You can see where the podiatrist comes in as part of the team there. The orthopedic surgeon and the podiatric surgeon did their thing. The vascular surgeon, before she was touched, did their thing to make sure that she had enough of a good blood vascular supply. But she's neuropathic. She can't feel that.
Right.
So, you know, so again, so yeah, that's one of the things we do. Diabetic feet, we saved a limb here. So save a limb, save a life.
Right.
Move on to the other one. And this is a lady, the one on your right. You can see she has no toes on the right foot, and she only has 2 toes on the left foot. And when I met this lady, she had 10 toes. She was offered amputations, but with a lot of hand holding, a lot of education. She saw a nutritionist. She changed the way she even started exercising. She improved her blood sugars. She changed the way she was eating. A lot of her problems with that, because she also has poor vision. She can barely see. And this is from the complications of diabetes, and she's got kidney disease. But she's got her 2 feet, and she's still mobile and independent, which is the most important thing, right? This comes closer to what we were meeting to talk about. You know, how does endometriosis come into all of this?
Oh, sorry.
So your eyes, her legs probably don't look as if they're swollen at all, but they are. And the little lesion that you're seeing in the middle of her foot, that dark area, was actually an ulcer. Wow. And that went on, well, we saw her in January, and 4 weeks later, we have healed her. So that's the other thing, venous disease, but swelling in the legs, and you can see how the skin changes. There's darkening and hyperpigmentation in some areas, and there's depigmentation in other areas. It's being able to capture these things early on and manage them, because what would have happened is that this lady would have presented maybe months later with a huge ulcer on her foot, and a lot longer to heal. So you can see where our work is so vast. It is, nail care, cutting nails, training people on toenails, corns and calluses, and grown toenails. But it's always the frictional forces of those corns and calluses as well. So someone may have a corn or a callus, and then you go, you know, why do they have the corn and callus?
Right.
And so we are kind of like private eyes as well. We don't just cut that corn and callus away.
And
we figure out why is it there. And then once we figure that out, we then treat it with various types of devices. We have digital splints that we make shoe adjustments. And of course, there's foot care advice. If I had and footwear advice, you know, if I had a dime for every time someone said to me, "Those shoes aren't tight," I'll be like, "That's a millionaire now."
I actually remember the first time we met in person, and you told me my footwear was not the best after we made a presentation.
I'm sorry, but I see feet. I see the way people walk. I see the way people their footwear, like how it fits them. And sometimes I see them in the office. I've now stopped telling people about their stuff until they come in the office. And then when they come in the office, I say, "Yeah, I knew that." I saw that. And they're like, "What? Are you serious?" Anyway, so what does podiatrists do? You see how exciting our job is? It's like in a day, we can go from trimming a toenail to treating an ulcer to, you know, coordinating the care, because that's the other thing that we do at Comfeet. You know, if we see the you need something. Over the years, obviously I've got my master's, and one of the things about your master's degree that it teaches you, if nothing else, is that there are no problems. There are always solutions. So, you know, living in a Caribbean island where there's limited access, limited resources, you have to be creative in order to assist, to get them from point A to point B. And if it means that locally it can't be sourced, whether it be a resource person, a human resource, or a natural resource of something that needs to come in, a special dressing, a special shoe, a special device, that's what we try to do. So yeah, it's very rewarding as well. So I hope that has given you a little bit of a flavor of what we podiatrists do. And yeah, when it comes to endometriosis, because here I am doing all the talking, because I know
no, that's fine, because you're the expert, right? But yeah, when it comes to endometriosis, we're seeing there's not as much, you know, research with peer-reviewed research with endometriosis and the foot per se. But I've been seeing more and more information come out about endometriosis and leg pain. If you can speak to that in more detail.
Right, there are not a lot of studies done in that area with regards to endometriosis and P.C.O.S. with regards to leg pain and foot pain, but I can tell you what our observations have been over the years.
Sure.
And over the years, we have found that there are people who present with significant discomfort in their legs, as in not only, so when we say legs, we're thinking knee to ankle, but some people get radiating pain coming down their thighs, down into their feet, aching, tiredness, heaviness as well. And you will look at their legs and they don't have any veins, they don't have any varicose veins, they don't have anything that really, and sometimes there's a bit of edema, there's a bit of swelling going on. And as you walk through with them, because what we do as podiatrists, we don't just see you and say bye, we kind of may have referred you to have a venous assessment done, referred you to various tests done. Sometimes it comes up with nothing. Of recent, well, over the last year or so, I actually send people to their gynecologist. And we're not just looking for necessarily endometriosis, but you're looking for anything in the uterine area. Wow. And I've had a couple people come back with having endometriosis because they then started putting it where when their menses is due and the womb becomes engorged, it puts pressure, and that pressure then stimulates that whole radiating pain, because it puts pressure on the sciatic nerve, and as the sciatic nerve goes down, that's where then you get those challenges. Sometimes this is where then you get the backaches and so forth as well, because of how much engorgement is going on. And then when you have full-blown endometriosis going on, you sometimes have this back pain that doesn't go away. And you want to know why it doesn't go away, and it doesn't go away because it's so inflamed for so long, and that puts, with inflammation always comes swelling. So you're going to get that swelling, internal swelling, that then is putting that little, you just need a little touch on the nerve. You don't need a big set. And that's where then, you know, you find sitting in certain positions it hurts, you know, lying down in certain positions it hurts. And for me, I think, you know, what it has done, and even my interaction with you in the past, what it has really sensitized me, and I really endorse the work that you're doing, because I feel that the younger generation, I mean, I have a daughter, I have a teenage daughter, and a lot of her friends, who some of them complain of this discomfort, and the challenge is that if they only maybe, just not every leg pain is an endometriosis pain.
No, right, you don't want to,
but it's a wake up to, should I get this checked? Should I investigate it? Should I see my gynecologist? Because this pain going on my legs is excruciating, it's really bad. And I didn't actually have a period. You know, I didn't really have much for bleed this year, this time, you know. So could it be something more? And I feel that that's where, as a podiatrist, if we are awoken to the fact that we have a young teenager coming in complaining of severe leg pain, you've investigated everything else and it doesn't tie with many things, let's not put aside
right.
endometriosis, let's say to them, you know what, why don't you visit your gynecologist? I know it sounds crazy that it's coming from me, but have an investigation and let's just see, you know, and we've actually found ovarian cancer as well by doing that. So I had a lady, you know, and every time it happens, I always go, please let it not be anything too serious, you know, but at least you've done the referral. And that's just why I think that, you know, we do have a role to play.
Thank you for outlining, you know, the possible relationship between, you know, endometriosis and leg pain, because I don't think a lot of people recognize how systemic endometriosis really is, which is why going into next month, which is Endometriosis Awareness Month, our theme is actually endometriosis more than a reproductive health issue, because so like you're saying, you can get the leg pain. We know persons that have thoracic endometriosis. We know persons that have endometriosis of the bowel, endometriosis of the urinary system, endometriosis of the central nervous system. You were talking about the sciatica, so that's your peripheral nervous system. Yes. So just to say that it doesn't only affect, you know, your reproductive ability. Endometriosis is systemic. It's you know, characterized by a lot of inflammation, a lot of pain, and it shouldn't be that pain shouldn't be dismissed. So thank you for that.
Most welcome.
And then, so we talk about endometriosis as it pertains to leg pain, but I want to talk about like PCOS, especially with the relationship with diabetes. Have you had, you know, patients that had diabetic complications and also were diagnosed with PCOS, and then was the management of those particular patients
that falls into that same multidisciplinary category, but I do find that PCOS is seen and more recognized as a relationship with diabetes and is managed a lot better. I do feel that it's not one of those things like, to me, endometriosis, which kind of slips under the radar. But you do hear of people saying that they have PCOS, and you know, sometimes they have the PCOS first. Sometimes that's diagnosed first, and then through investigations, they are also found to be diabetic. So I have seen quite a few women with that, and I would say that obviously when it comes to diabetes in the feet, you know, it is a silent killer, and it is the same way you have PCOS going on silently as one of those things with diabetes. It's the eye disease, it's the heart disease, it's the kidney disease. It's a lot to do with the fact that the microvascular is a microvascular disease. So as a result of that, a lot of our organs that are needed for blood supply, where the microvascular, whether it's the nerves, whether it is the vascular system, is affected. So my thing would be that look after yourself. I think coming out of all of this, there is interconnectivity, and we don't know until you know.
Until you know.
You shouldn't put a plaster on, oh well, I just have X. You know, if you've had a headache or a tummy ache and various things that are going on that are unusual for any length of time, it's really important to investigate. I always say to my patients, it's better to call me with a foot problem and let me know that you are having a diabetic issue, and let me tell you let me tell you that it's nothing to worry about, as opposed to you keeping it and going, oh, this is nothing to worry about. As soon as there's something wrong, investigate it, because you might be, as they say, a stitch in time saves 9. So when it comes to endometriosis, when it comes to PCOS, whatever we're dealing with, and because we're focusing on that right now, I would say when you're feeling, you know, you're having your cycle all along, but then your cycle is not quite right, you know, investigate it, you know, and don't wait till when it is just a sterility feeling of and investigations. And it's an awareness that we all have to have with regards to our children. So whoever is watching, I feel the message has to be for us to target our youth as well, to be more aware of the fact of what can happen, because we know it can really, when you find out later, it can be so distressing to your life. And the longer you have endometriosis as well going on in your system, it's an inflammatory, it can affect many other parts of your body.
Yep. We need to just keep repeating that. It's inflammatory, it's systemic, it can affect all the other parts of your body. At one point it was said that it was found in every part of the body except the spleen, but apparently there was a recent case report that it's now been found in the spleen. So every system.
It's an inflammatory, you know, and it can move itself depending around. So, you know, as I said, I laud the work you do, because I think of the work that you're doing with this association quite similar to us as podiatrists, because we are like a needle in a haystack across the world, and this is true. And you know, I do believe that we have to lift each other up in order to win.
Yes.
So, you know, thank you so much for even inviting me and thinking about me. But at the same time, I'm really glad for the opportunity to share some of my knowledge on what I have experienced over these years.
Thank you. I really wanted to reach out to you during the first season, but you know, everything happens for a reason. We discussed that earlier this call. So
I forgot that Bible verse if it was.
Yeah, I think this was like the prime time to have this. So I'm so happy about that. So we've had this really rich conversation, and I'm going to get to a point of the conversation that I probably would not like to talk about, but we're going to have to talk about it. Footwear do's and don'ts.
So let's just say the first thing I want to demyth everyone with is you do not know what shoe size you're wearing. I think that's the point where I'm at. So whatever you think that you thought your shoe size was, it's not.
Oh, okay.
Because most people wear the wrong size shoe. They wear shoe for style. They wear shoes because a friend has it, but they don't wear shoes because they fit. You can't wear a shoe where your foot is hanging out, where your heel is hanging off. You know, your shoe should be encompassing the entire foot. And you should be able to put your foot in your shoe, and you should be able to wiggle your toes. So my other new thing is, do not get hung up on size. We have a lot of people who go, gosh, I can't imagine myself in a 12. I already wear 11. And I'm like, so what? Your feet are going to be happy. You're right. So don't get hung up on size. Use your shoe size that you think you are as the beginning point to buy a pair of shoes. Another thing for us women who have some of this engorgement in like endometriosis and so on, you get swelling, and sometimes you get a little bit more swelling at the end of the day. So it's important to buy your shoes in the afternoon. But if I had to put it all in a box, it's just make sure that you have a thumb's width over your longest toe. And remember that your longest toe could be your second toe, so it doesn't always have to be your big toe. Make sure that there is space on either side of your shoe. So it's a nice way is just to press the shoe to make sure that it's not feeling taut. Make sure that you can wiggle your toes in your shoe. And when I say wiggle, I mean stand and wiggle so that every single toe, 1, 2, 3, 4, 5 toes on each foot, right? So all 5 wiggle. And if they're not wiggling, there is a restriction. So it's time to think about different style shoe even if it's not that a size, because some people say, well, if I go up a size, my shoe is going to slip off my foot.
Right.
That's because you need a different style shoe. It may just be that style doesn't work for your type of foot. So the main tips there would be making sure you have the right width, the right length, the right depth. Depth is something that we take for granted of as well. And if you have a bunion or you have a hallux rigidus, which is a thickening at the ball of the foot, you'll find that the shoe needs a deeper toe box. And there are shoes out there for those type of feet. And some of them are much more fancy than they used to be as well. So I'm demystifying all those people that say that orthopedic shoes are ugly. No, they're not. That's not true.
Okay. I'm happy that orthopedic shoes have gotten cuter. That was always a concern. So thank you for
much cuter.
Yes.
We wear them in our offices.
Okay, good.
My colleague and I wear them, and people come in and go, oh, those are cute. And I'm like, yep, they're orthopedic. And they go, really? And I'm like, yes. And sometimes they see them on the shelf and they go, they're so ugly. And then they put them on their
On
foot
the
and they go, oh,
feet.
actually, they're not so bad. So I say
Yeah.
that to say, give them a chance.
Okay, fair enough. Everyone give them a chance. So I think we've covered a lot. I guess we can end off by thinking about what should we be regularly doing when you want to consider good foot care regime. Like obviously we might still have to come to you and other podiatrists in their practice just for maybe a checkup, but in general, what should we be doing to maintain good foot care?
So when you go in the shower, make sure that you soap between your toes and your soles of your feet as well. When you come out the shower, dry between your toes and practice looking at your feet, you know. I actually say to patients now, because I'm also avid about movement and exercise as we get older. So if you're getting to a point, and no one goes from being slim to obese overnight, it happens over a period of time. So if you are actively going down to touch your feet and you're starting realizing, well, I used to be able to go down there and I can't go down there anymore, that actually acts as a really good way for you to start exercising because you must be able to get down to those feet. So you examine the bottom of your feet and you use a moisturizing cream on a day-to-day basis.
Yeah.
Do not use the cream between the toes. And you may find that you may have to move around from one moisturizing cream to another. So there are some people that say, oh, I use this cream, it worked really well for me, but it may not work well for you. You know, so I always say to people, buy the smaller tube or the smaller bottle, try it for a little while, and if it's working, it's fine. If it's not, and it helps to control the dryness and the fissures and so on that women have. So the main thing is washing and drying and using moisturizing cream on a day-to-day basis. Trimming your nails with a device, and if you don't have a device because you're scared to use one, just file them. If you file your nails, you're not going to ever be able to damage yourself. And you're also going to be able to file them to the point where you can't actually go down in the corners. So your corners are going to be safe from you. And then with regards to if you're a lady that uses nail polish and that kind of thing, because nail fungus is another thing that's near and dear to our hearts, because we do see a lot of people with concerns of long-term nail fungus. If you're using nail polish, don't leave it on forever. A lot of us put on nail polish and it stays on for months. You know, 2 weeks, take it off, allow the nails, not necessarily to breathe, but allow the natural oils from your body to spread across the nail plate and keep them moisturizing. When you're moisturizing your skin, you're actually moisturizing the nail bed, the nail plate as well. And I would say as tips, specifically that if you're someone who suffers with corns and ingrown toenails and those kind of things, yes, some DIY work does help. But I would say sometimes it can be nipped in the bud easier if you saw a podiatrist first. Corns and calluses can be treated, and sometimes you can get rid of those corns and calluses just by creaming, you know, like if you start by just creaming, putting some moisturizer there so that there's no frictional forces. So if you're doing that on a regular basis and the corns and calluses persist, then have them investigated to see if it's a biomechanical reason why it's there, and then that could be probably fixed as well. The longer you have a corn or callus, it can actually cause scarring, and then it makes it very difficult for it to actually go. The management is a lot longer. So my other thing would be to be aware of your feet. Know when things are going wrong, when you see things that would not have been there before. And also pigmented color, you know, sometimes we feel that we get away from things like malignant melanoma and those kind of things. But on a serious note, you know, we do get all sorts of things. Everyone can get it. We all have just a different pigment in our skin, but we have the same types of structure of the skin. Everything's the same. You may have a different type of molecular structure with regards to moisturizing and that kind of thing. But the reality is the basic structure is the same. It's the same. So yeah. My reality is to just be aware of your feet and love them. touch them. You know, they're not as dirty as you think. And if you're soaping them and cleaning them and paying attention to them, then maybe you wouldn't have to see many of us for too very much at all.
Mm-hmm. Thank you. So love your feet. I think that like
love your feet.
Love your feet.
Yeah.
Take care of your feet. Show love to your feet.
Well, we usually tell our patients, once you've come into our place, your feet are now ours. So when they come back, they're like, so how's my toe doing? And they're like, my toe is my toe. I'm like, no, it's my toe. From when you came through the door, it's my toe, because you know you look after other people's things better than you look after your own.
True. So true. So yeah, thank you. This is a really enlightening conversation. Again, all the times I've done this, I've come into these conversations thinking, you know, it's going to go one way with the host, and it goes in a beautifully different direction, which I really appreciate because of the, you know, we reached out to you because of your subject matter expertise and your insight, and I'm just so appreciative that you were able to bring that to the fore here. I'm sure that there are going to be a lot of other persons that are going to benefit from the information you just provided. So with that being said, I'm going to place your Comfeet's information at the end card of this chat here, so that if anyone wants to, if they happen not to know about Comfeet, which I don't think is possible in Barbados, but if they happen not to know about it, at least they will have that contact information. So thank you so much, Dr.
You're most welcome, and again, thank you for having me. And yes, we actually have, you can catch us on many things. So even if you don't want to do that phone call, just send us an email, WhatsApp.
And they're in our resource list.
Yeah, Instagram. We're all over the place.
Yeah, exactly. Good. And, you know, I think it's, like I said, I think this was a great way to segue into Endometriosis Awareness Month when we are focusing on endometriosis within the other realm. So I appreciate you allowing us to have this conversation with you to do that.
And thank you so much, too.
Thank you. So thanks to everyone else that joined us. We will see you again next month, which is Endometriosis Awareness Month. So stay tuned. Thank you. Bye.
Bye-bye.